Hello and welcome to week 12 of PUBH 612. Today we will discuss planning sampling designs and data sources for effect evaluations. And this is chapter 13 in your text. The learning objectives for this week are to select an optimal strategy for sampling for an effect evaluation, to explain the importance of a sample size, to assess secondary data sources for their validity and reliability, and to develop a plan for addressing missing data. Sampling and how you collect data from participants are critical decisions that you will have to make when developing an evaluation of the effects of a program. The term sample refers to the groups whose members were chosen to be a part of the evaluation and who were selected from among those who received the program. Here are some steps that you can take to come up with your sample. First, you need to identify the target population and the program participants and develop a plan to select the least unbiased sample from each group. Unlike sampling in a research project, there are some limitations to sampling for program evaluations. First, you are limited by the number of people who can and did participate in the program. And it's sometimes hard to decipher who did and didn't participate in the program and who was a part of the intended audience. Here are some sampling strategies which can be used with hard-to-reach populations. One strategy is random digit dialing, which involves generating phone numbers based on randomly generating the last 4 digits of the telephone number. This approach is less effective today than it was previously, as less people have landlines. You can also recruit people online through websites or social media ads, and there are many approaches associated with respondent-driven sampling, such as snowball sampling. And this is where a key informant will provide you a referral to other potential participants. And then, like a snowball, you would follow up with those additional participants to see if they have any other suggestions for other people that you could contact and who may be able to participate. You can also do venue-based sampling, and this is when you go to a location to find potential participants. And this strategy was first developed as a way to reach high-risk populations whose behaviors were associated with specific locations, such as bathhouses, gay bars, or tattoo parlors. The response rate is the percentage of people who were invited to participate in the evaluation who actually wind up participating. And a good sampling strategy should help to yield a good response rate. Other factors to consider with the response rate are whether people completed all parts of the evaluation or just some. And response rates range from a high, which is considered 80% or greater, to a low of less than 30%, which is typically found in something like a mail survey where there are minimal incentives to participate. And in order to calculate your response rate, you're going to need to track invitations, who you're asking to participate in the evaluation, who's eligible, their refusals, and the number of people who complete the evaluation. No matter how well your survey is designed, chances are some people will not want to participate. You can make efforts to minimize non-response, but attrition, or when a program or control participants drop out of the evaluation, can happen for several reasons, such as death, moving and being lost to follow-up, refusing to participate, or just becoming ineligible. If you expect many participants to be lost due to attrition, you may need to increase your starting sample size, but this will increase your costs and you need to be prepared for that in your evaluation. Another way to try to improve response rates is by providing an incentive, such as money, gift certificates, or other small tokens of appreciation. Designing a monetary incentive must take into account the total payment amount as well as the payment schedule. The total payment amount can't be so great that it could be perceived as coercive. That would be unethical. But it also can't be too small that it's not a good incentive and people don't want to participate. Also, you need to provide an incentive at each data collection point, so make sure you're appropriately spacing out the payments across the time frame of your evaluation. Non-monetary incentives could be food or other items. I've seen pedometers, bike bells, metro cards, all used as incentives instead of a cash payment. Here is a table of non-probability samples and their implementation ease, representativeness compared to the general population, and a sampling frame. Convenience sampling, as the name implies, is convenient and the easiest sample to gather. All you need is a willingness to participate in the evaluation. But there is no guaranteed representativeness compared to the general population. While snowball sampling can be more difficult to implement and is also not likely to be representative and it's likely to be biased, but it is good if you're interested in looking at a network of participants. Here is a list of probability sampling methods. And you can see that simple random samples are fairly easy to implement. You can use a random number chart, and the generalizability is high to the entire population. Another type of probability samples is a cluster or nested sample. And this is a little bit more difficult to implement once the cluster has been identified, and it also has a fairly high generalizability if you've randomly selected your clusters and the individuals within the clusters. So say you're looking at a county, you could randomly select 2 towns in the county and then randomly select individuals within the towns. Sampling for an outcome assessment relies on non-probability samples, and these strategies are easier to implement and they're easier to explain to stakeholders, while an outcome evaluation typically relies on probability samples, and it will increase the generalizability of the findings, but it also will increase the costs and the complexity of implementing the evaluation. Here is a section of Table 13-3 from your text, which shows some of the potential data sources for different health domains. So you can see that for physical health, self-reported survey data are commonly used, as well as analysis of secondary data from things like medical records. You can also use physical data from lab tests or weight that you could capture from scales. And you could also observe physical health to see if someone is, for instance, having labored breathing after walking a flight of stairs or running a mile. When developing a questionnaire, you should consider these things. We've discussed most of these already in the semester, but once again, make sure that you're using an existing validated item or scale if it's possible. And you should also make sure that you've tailored the questionnaire to be appropriate for the culture of the participants. And you should avoid using the number of client goals achieved as an outcome measure. And it's a best practice, if time and money permit, to do some pilot testing of the questionnaire before the full evaluation starts. Some secondary data sources would be vital records such as birth and death certificates, medical records and insurance claims, as well as national survey data. Big data are large amounts of complex, diverse data from surveillance program client records, electronic health records, and medical billing records. And these are increasingly becoming available for public health purposes. And big data are characterized by the 4 V's shown here: volume, velocity, variety, and veracity. The key takeaways for this week are to remember that sampling can have a major influence on the results of your evaluation. And so you should spend some time thinking about how you're going to select your sample for your evaluation. And you want to develop a sampling strategy that's going to yield a higher response rate. And incentives are commonly used to improve response rates, but make sure that your incentives aren't coercive and are well thought through so that you don't give participants all of the incentives before you've captured the information that you need from them. Lastly, big data is increasingly being used in public health, and as we've talked about before, harnessing new technologies or reanalyzing existing large secondary data sources is an interesting and growing opportunity for public health researchers. Here are some additional internet resources that you can check out, and please be sure to look at Blackboard for any additional materials this week. Thanks a lot. Bye.